We'll leave it at this point to return now to this discussion on health care legislation hosted by House Republicans.
Leader John Boehner, the ranking members from the Budget Committee, the Workforce Committee, the Energy and Commerce Committee, and the Ways and Means Committee have been active. Many of our doctor members have been involved here, as have others involved in health care. So 24 of us have worked hard to put ideas out that we think would send the system in a better direction. I think it's very fair to say that this healthcare solutions group wants to create a system where people have more access and more competition that creates both a better price and more patient satisfaction, but with a real focus on the doctor-patient relationship. Beyond that, I'd say that we're here today to really talk about what might happen if you wind up with a government competitor that eventually becomes the only competitor, and our panel is a panel that has real experience with that, both in terms of medical tourism, personal health challenges, and economic impact, both in Canada and in Great Britain. Let me go next to others for some brief opening statements, and Dr. Gingrey, if you're ready, we'll see if we can make these mics work the right way. And I don't know if we did.
Yours has to go off first before his goes on.
I turned mine off first. Now, is yours on?
Is this on? It is. I believe it is. Well, surprise, surprise. So, well, Mr. Chairman, thank you very much. And, of course, this health care working group that, as Chairman Blunt has described, that we've been working together, the group of about 24 of us, and as he pointed out, the ranking members of the three respective committees of jurisdiction, Education and Labor, Energy and Commerce, and Ways and Means. And we have a number of physician members. I happen to be one of the physician members and a member of the Energy and Commerce Committee and the Health Subcommittee. So we bring a lot of talent. We bring a lot of experience to the issue. We clearly feel that health care reform is needed. And our system, while it is the best health care system in the world, it's not perfect. And we ought to always strive for perfection, and that's what we have done in this committee as we have worked tirelessly to present the Republican alternative to health care reform that doesn't turn it over lock, stock, and barrel, throwing the baby out with the bathwater, I like to say, to the federal government. We are for insurance reform. We are for delivery reform, not necessarily babies, but the delivery of health care in general. We clearly feel that liability reform, expanding electronic medical records, giving everybody access to health care, creating high-risk pools, equalizing the tax treatment. I could go on and on and on, but there are other members of the panel that are more expert on some of those areas than I am, but I've been proud to work with this group. I think we've got a great plan. If just given the opportunity to sit down with the Democratic majority and with the president, I think we could show them how to fix this system and fix it right. And I really welcome the panelists and look forward to hearing their testimony and asking them some questions.
Well, let's go next to our whip, Mr. Cantor.
Thank you, and I want to just commend you, Roy, for having this panel today, because I think it is very important that we respond to the many questions that the American people have with regard to what a government health care plan would mean for their families. And as we know, there are many people across the country that are very, very uncomfortable with the rush to get something done if we don't get it right. Health care obviously is important to every man, woman, and child in this country. And frankly, as we saw last night with the president's press conference, there are still a lot of unanswered questions as far as his plan is concerned and that which is making its way through Congress. The reality is, right now, as it stands, there is a bipartisan majority against the bill, which creates a government health care plan. And the reason, I think, for a lot of that opposition has to do with the uncertainty around what government health care has produced in other countries and what that would mean for the ability of American families to continue to access the kind of care, the quality of care, the timeliness of care that they have become used to, or that many that have health care have become used to. So I look forward to this hearing, and I want to welcome the panelists and thank them very much for being here.
Okay, let's go to Mr. Klein, who's the ranking member on our Workforce Committee, joining us today.
It turns off, right?
I don't think this microphone is working. Oh, no, it is working now. Thank you very much, Mr. Chairman. I want to thank the panelists for being here. It's particularly gratifying to have an expert all the way from the United Kingdom who is willing to stay with us on the phone. Let me just say very briefly that we looked at this bill. It was 1,018 pages. After it was 852 pages, and then there's a manager's amendment. It was 1,040 pages, and there are some very, very troubling concerns. We in Education and Labor marked up this bill, tried to amend this bill, starting at 10 o'clock on one morning and going straight through until 6 o'clock the next morning. A very healthy debate. As my friend Dr. Gingrich said, there are many physicians. We had 3 physicians on the Republican side in that committee, and I can tell you that they were engaged, and we would have been happy to stay engaged if we could fix this bill. Our concerns are enormous. This legislation creates a new federal bureaucracy, and with a new commissioner you can only think of as a high commissioner, because it's an enormously powerful position to fundamentally, I believe, wreck the delivery of health care in this country. So I'm just delighted to be here. I applaud the work of my colleagues, and I'm really looking forward to the testimony of our witnesses. Now, I yield back.
Okay, Dr. Fleming.
Okay. Can you hear me? No? Yes? No. It's hard to see. Okay. Thank you. Yes. Thank you, Mr. Chairman. I just want to say briefly that there are 3 fundamental problems with the takeover, the government takeover of this health plan. One is cost, despite what our president says, despite what members of the other side of the aisle says. Every analysis that has credibility, including the CBO, says the cost will go up for years, and in fact, in the out years, it will go up in an infinite way. Bureaucracy, stepping between the patient and the physician, a sacred relationship. It's tremendously bureaucratic. We may hear more examples of that today in other countries. And then finally, a big concern, despite where you may be on pro-choice or pro-life, this provides for taxpayer-funded abortions, which 69% of the American people are against. So we have really some very fundamental flaws with this plan. And quite honestly, despite what you hear Democrats say, every single Republican is not for the status quo. We are for true health care reform, common sense health care reform, not nonsense health care reform.
Paul Ryan.
I'm Paul Ryan. I serve as the ranking member of the Budget Committee, and I also serve on the Ways and Means Committee, which just marked this bill up last Friday morning. A couple of cost points I think ought to be made, given that we're here to learn some experiences from other countries that have done this. Number one, the Congressional Budget Office is telling us that not only is this bill not paid for in the first 10 years, it has a $239 billion deficit. I expect the majority will probably close that. But what they're telling us is the costs grow at 8% a year, and the offsets grow at 5% a year. What that means is Congress is on the verge of creating a new entitlement, which will be unfunded, a new unfunded liability on top of the ones we already have, Medicare and Medicaid. And the reason I point this out is it's very important that if the government is to essentially take over the rest of the healthcare sector, outside actuaries are telling us that with the public plan option, 2 out of every 3 Americans will lose the private coverage they have and be dumped onto the public plan in about 3 years because of the cost shifting that occurs. If the public plan underpays providers, as they do typically 30% underpayment on hospitals, 20% underpayment on physicians, then what will happen is they will overcharge on private plans. This will precipitate an enormous dumping onto the public plan, whereby the public plan option inevitably becomes a government-run monopoly. And under that kind of a system, with huge cost explosions, a $38 trillion unfunded liability for Medicare, we estimate about a $20 trillion unfunded liability for Medicaid, an additional unfunded liability for this new entitlement, the only way to solve this cost problem, the only way to deal with our spiraling debt and deficits that will come is to ration care. And that, I think, is one of the reasons why in the stimulus package, the Institute of Comparative Effectiveness was formed in the first place, which is to design what will and will not be paid and reimbursed for providers. And so we are very fearful that instead of addressing the problems that we want to address in healthcare, cost, accessibility, making sure the uninsured get insurance, making sure people with pre-existing conditions can get affordable health insurance, we believe we can fix those problems without the government taking it over, without new taxes and new spending. Unfortunately, the path that this bill is on is going to put us in a position where distant bureaucrats will have to make cookie-cutter decisions on how medicine is to be practiced in America if we're ever going to deal with the cost explosion that is just right around the corner. And the fear we have is that that will take that patient-doctor relationship out and replace it with bureaucratic dictates who do not know the uniqueness of a particular patient's ailments. And inevitably, in order to get cost containment down, rationing, I know that's a dirty word, but rationing must inevitably occur. And that is why I think it's valuable that we don't rush this to the floor, which is being done next week, that we patiently look at this and that we learn from the experiences from other countries as to what this road looks like that our new government is trying to put us down. And that's why I'm excited to be here and be a part of this and hear some of the input we're going to get from our witnesses. Thank you.
Mr. Whitman.
Thank you, Mr. Chairman. It's an honor and a privilege to be here today as part of this group and to have these fine folks before us to testify today. As you've heard, the common theme amongst this is solutions to health care, and the solutions rest in reducing cost. That's the bottom line. And you've heard a lot of different aspects about where the problems are with this bill and where it does not reduce costs. We hear from the governor's conference about their concerns about increasing cost of Medicaid. They are deeply concerned about that unfunded mandate. Also, the Congressional Budget Office speaks of the unsustainability of this bill past 2012. Also, the Mayo Clinic points out the problems with the bill and its sustainability. As we see, we want good, workable solutions that get to the basic issue at hand, and that is controlling costs within this system. At 17% of GDP going to health care cost and that rate growing at 1% a year, everybody in this Congress realizes what the issue is. It's cost and containing cost. Secondly, what you've heard is also about making sure that we maintain the integrity of the patient-provider relationship. That is also critical in whatever comes out of this body, is to make sure that we maintain that. That's where the most efficient decision-making takes place, is between the patient and provider. We must preserve that. We must do all we can to reduce cost. If we do that, we create a sustainable system of health care in the United States. The current path we're on is not sustainable. The bill that is currently before us does not create that sustainability, and it interferes with the patient-provider relationship. So we are here to make sure that we can achieve those two goals in our efforts, and hopefully we'll find folks on the other side of the aisle that will be willing to work with us in getting that accomplished. And again, thank you so much, Mr. Chairman, for being part of this today.
Thank you, Rob. And we're going to struggle with this for a while. First of all, let me mention some of the things I want to say here, which is to reiterate that the choices are not the choices that the President laid out last night. The President's been an expert at creating this straw man that you can either do what he wants to do or we can do nothing. Nobody on the solutions group, and my belief is nobody in the Republican side of the aisle in the House believes that we couldn't make this system better. And in fact, we're proposing plans and ideas and legislation that would create access for everyone to the system, regardless of pre-existing conditions, that would create more choice and more competition. Choice and competition will have more impact on price than anything else. And as has been said several times, we're also convinced that if you have a government provider, every outside study that is objective on this indicates that